Human immunity. This presentation is about the human immunity. It states the non-specific defences against diseases by covering many criteria. It will also include the specific immunity and immune responses and will show the understanding of the biology of vaccinations. The causes of ill health will also be stated in this presentation. Any questions that would like to be asked can be done so at the end of the presentation. The skin and inflammation. The skin serves many purposes to the body. One of the major functions is to protect the body from infectious organisms such as parasites, bacteria or viruses that can cause the disease. There are three primary layers of the skin. The outermost layer, which acts as a physical barrier between the body, dirt and bacteria outside. The innermost layer, which contains several different types of cells to protect the body from a disease. And the hypodermis layer, which contains the cells known as fibroblast, adipose tissues, connective tissues, larger nerves and blood vessels. We will now be going on to talking about inflammation, which can appear when injuries occur. The primary physical effect of the inflammatory response is for blood circulation to increase around the infected area. The effectiveness of barriers to infection through body orifices. The mucous membranes prevent infectious agents, pathogens and allergens from attacking the body, whilst allowing the nutrients through for the body to keep its healthy tissues. Some effective barriers of infections through the body are the gastrointestinal system, which contains effectiveness barriers against infection. The nasal cavity and airways allow pathogens to enter the body through the nose. However, these can be filtered out before they pass the barrier between the body and external environment. The urinary tract has several effective barriers to infection and protects the bladder. In males, the urethra is long enough that the bacteria can hardly pass through, which washes the pathogens out. This is same for females also. However, the urethra in the females are shorter than adult males, which allows external bacteria to pass into the bladder. During pregnancy, the bladder doesn't have much protection against pathogens, which makes urinary infections quite common. The female genital tract. This is a vagina. Vaginal contains bacteria that forms lactic acid. The pH of a healthy adult vagina prevents harmful bacteria from growing and helps keep the protective bacteria. The roles of the thymus, lymph nodes and lymphatic ducts. The thymus serves a vital role in training and development of the T cells, a white blood cell which defends the body from potentially deadly pathogens such as bacteria, viruses, fungi. The main function is to release the hormone that will stimulate the maturation of T cells. Once the T cells have then matured, they will migrate to the lymph nodes. Only the T cells that have properly responded to the antigens will be selected to survive and migrate to the medulla. Lymph nodes are masses of tissues located in the lymphatic system. They filter lymph fluids before returning it to the blood. The lymph nodes help to prevent the fluid in the build-up of tissues, defend against infections and maintain normal blood volume and pressure in the body. They filter lymph and assist the immune system in building an immune response. Lymphocytes originate from the bone marrow stem cells. Lymph nodes filter lymph of harmful pathogens such as bacteria and viruses. They filter out cellular waste, dead cells and cancerous cells. The lymphatic duct is smaller than the thoracic duct as it only collects lymph from the right side of the body. The role of the macrophages in removing pathogens or inert particles. Macrophages are important components of the immune system. They are formed due to an infection or the damaged cells made up through different types of white blood cells called the monocytes. When the body has an infection, the monocytes will leave the bloodstream and enter the affected tissue or organ. Macrophages can change themselves from different structures to fight specific types of infections. They also take part of non-specific or innate immunity, which is developed when a macrophage first digests a microbe and produces white blood cells. Acquired immunity and sensitivity to antigens. Pathogens are infectious agents and antigens that are parts of the pathogen to tell the body it's being attacked. Acquired immunity is often called specific immunity because the immune system remembers its attack to a specific antigen that the body has previously met. Acquired immunity is not present at birth. As a person is exposed to natural environment, the body's immune system then comes across antigens. Acquired immunity is a learned response from the body's immune system deciding the best way to attack each antigen and begin to develop a memory for that antigen. It quickly fights off infectious agents, usually before the disease symptoms become apparent. Artificially acquired immunity is different from naturally acquired immunity. This is mainly because the artificially ones involve some of the human interventions. The immune system does not have the same level of sensitivity to all antigens. Hypersensitivity describes an abnormal immune reaction that is caused by an immune response to the same antigen. Roles of the immune cells and immunoglobulin. There are 5 different types of leukocytes which are produced in the bone marrow. Firstly, there's lymphocytes, which play a major role in the humoral immune system. And then we go on to the monocytes, which turn into macrophages when leaving the bloodstream, so they do the job of cell eating of any type of dead cell in the body. The eosinophil, which are quite rare in the bloodstream, they work by releasing the toxins of the granules to kill pathogens, mainly parasites and worms. The basophil, which is also very rare, they act immediately as part of the immune system's action against the foreign invaders. And lastly, neutrophil, which are most common types of white blood cells. Neutrophils are the first cells to reach an infected area. There are 2 types of lymphocytes of the acquired immunity system. Firstly, we've got the T cells, which cannot detect foreign substances by themselves and require assistance of the antigen cells. They break down the foreign substances so that it can mount a response, and once the response is there, the T cells will then activate and different types of T cells are released into the bloodstream. Secondly, we've got the B cells. In the humans, maturation takes place in the bone marrow. When activated, B cells release huge numbers of antibodies. B cells play 2 major roles in terms of the immune response: antibody production and presenting antigens to T cells and providing signals for the T cell activation. There are 3 types of T cell lymphocytes. There's cytotoxic T cells, which act to defend the body against viruses. They require activated antigen present in cells relying on the presence of helper T cells. Cytotoxic T cells also release certain enzymes that destroy the cell structure. We've got the suppressor T cells, which can suppress the functions for both helper and cytotoxic T cells. This is done to regulate the other cells of the immune system, stopping them from causing excessive damage to the body's own tissues. Then we have the helper T cells, which are the most common type of T cells. They act through the release of lymphokines that help control other parts of the immune system by motivating other types of T cells to grow and attack. They also help B cells to grow and mature into their active form. Going on to the immunoglobulin, which are antibodies, have many uses within the body. Right, we've got immunoglobulin A, which is the second most abundant immunoglobulin. It plays a large role in the cellular defence of the soft, moist, muscular surface of the body. The immunoglobulin M is slightly different to the others. It comprises 5 normal immunoglobulins joined at their bases. Immunoglobulin G is the molecule can stimulate an attack on anything that it recognises as being foreign. The immunoglobulin A is the largest of the immunoglobulin molecules and is only present in a low levels in a healthy individual. And lastly, the immunoglobulin D is a relatively uncommon molecule which remains unknown. The tolerance to own tissues and the rejection of organ transplant. 2 most important factors in allowing the immune system to know the difference between self and non-self are major histocompatibility complexes, class 1 and 2. The human cell shows certain antigens that the immune system recognises as being self, When there is a red blood cell, it will not get targeted as an antigen, it is recognised as self. However, when the immune system detects an antigen that has not been seen before, it will be non-self. The B cells and T cells will then follow with their responses. The MHC class 1 molecules act as a warning to the immune system. If the cell is foreign, it will degrade the proteins into fragments and display them on the MHC class 1 cell surface. However, the MHC class 2 molecules are similar, yet are only present in some cells. They act as an extracellular presentation mechanism that present antigens from extracellular pathogens. They are endositized by B cells and phagocytes, which are digested using lysosomes, and the antigen fragments are shown by the MHC class 2 molecules on the surface of the immune cell, which is then picked up by the T cells. Going on to the organ transplant, rejection transplant. When a person receives an organ from someone else during transplant surgery, the person's immune system may recognise it as foreign. This is because the immune system notices that the antigens on the cell of the organ are different. There are 3 types of rejection. So we've got hyperacute rejection, which occurs a few minutes after the transplant. Then we go on to the acute rejection, may occur any time from the first week after the transplant. And then we've got the chronic rejection, which takes place over many years. The actions of vaccines that provide active and passive immunity. Active immunisation prevents an infectious disease by activating the body's production of antibodies that can fight off bacteria or viruses. Natural active immunity involves the production of antibodies by B lymphocytes and cell-mediated responses with T lymphocytes. Artificially induced active immunity means an individual exposed to foreign antigens to be able to generate a protective immune response. The natural passive immunity are antibodies that are moved from one person to another through natural means, and the artificial passive immunity can be induced artificially when antibodies are given as medication to a non-immune individual. So now we'll go on to analysing scientific factors influencing immunity provided by a vaccine. The factors relating to the host that can impact upon the efficiency and effectiveness of a vaccine can be broken down as follows. So firstly, we're going to age, which is an unfortunate fact that vaccines induce antibody responses quickly in the elderly. This is because of the composition of the T cell pool. The comorbidity, vaccines have tended to be much less effective in patients because of the immune system being overwhelmed. The human immune system is more effective when it can actually deal with one condition at a time. And then we'll go on to time since vaccination, which it considers several characteristics. It considers the difference between a disease and the vaccines. Lifelong immunity is very rare, so for this reason, vaccines are recommended at a different time of life. Then we go on to vaccine characteristics. So the mode of delivery is critical to the safety of the patient. The routes of administration for most vaccines include oral route, subcutaneous route, intramuscular route. Then we go on to live versus inactivated. So live vaccines are made using wild viruses or bacteria that have been attenuated or weakened before being included in the vaccine. And then the inactivated vaccines are made of using wild viruses or bacteria that have been grown in a culture medium and inactivated before being included in a vaccine. So after immunisation, the vaccine antigens cannot grow in the vaccinated person or cause disease. Analyse factors influencing vaccine safety. So vaccine safety is always assessed before licensing for use. So during vaccine development, initial safety testing procedures occur in 2 stages. So the first stage involves preclinical laboratory-based assessment. If a vaccine being tested failed, the basic safety tests at the early stage will not progress to the clinical trials. The phase 1 is where the vaccine passes a preclinical assessment, then it can enter the clinical trials. The phase 2 is where the vaccine is administered to a larger number of people with the intention of determining how effective the vaccine actually is. And the phase 3 is the stage where the clinical trial processes is demonstrated on a larger amount of people to know the protection is there in the vaccine. Careful monitoring continues even after the vaccine has been passed to be used as safely, but monitoring has to be done to know the side effects of some vaccines. So then we'll go on to discussing the concept of herd immunity and isolation of infected individuals to protect the communities. So when a high percentage of the population is vaccinated, it is more difficult for contagious infectious diseases to spread. Herd immunity does not protect against all vaccine preventable diseases. Herd immunity can stop the spread of some contagious diseases in a given community. It is particularly crucial for protecting people who cannot be vaccinated. Once a critical number of people are immunised, they help to protect members of their communities by reducing the spread of the disease. The microbes that cause diseases all have different characteristics which affect the rate of the infection. Following the detection of an infectious disease, healthcare professionals need to separate those who are infected with those who are not infected, so they all need to be separated and correct PPE should be used and everything should be cleaned properly. Evaluate the effectiveness of the 3 commonly used vaccines. So we're going to talk about the flu vaccine, the MMR and the hepatitis B. So the flu vaccine was effective at reducing the risk of flu illnesses by about 50 to 60% in the UK. So they cannot protect against infections and illnesses caused by other viruses that cause the flu-like symptoms. And then the MMR vaccine is designed to protect against 3 diseases, which is the measles, which is a highly infectious disease and can spread through the air, mumps, which can also spread through the air, and rubella, which is the same as the others and is contagious as well. These all 3 can be prevented by the vaccine only. And then we go on to the hepatitis B, which is a life-threatening liver infection caused by the hepatitis B virus. It can cause chronic infection and puts people at high risk of death. Explain how the immune system may cause ill health. There are many ways the immune system can cause ill health. The lymph or lymphatic system is a major part of the immune system. Its network of lymph nodes and vessels. The lymph contains tissue fluid, waste products and immune cells. They contain white blood cells that trap viruses, bacteria and other invaders, including cancer cells. The immune system is the body's defense against infections and other harmful invaders. The immune system is made up of special cells, tissues, and organs that work together to protect the body. There are some immune system disorders, which are the severe combined immunodeficiency, which is where children are in constant danger of infections from bacteria, viruses, and fungi. The temporary acquired immune deficiencies is where the immune system can be weakened by certain medicines. AIDS is an acquired viral infection that destroys important white blood cells and weakens the immune system. An overactive immune system is if someone was born with certain genes, the immune system may react to substances in the environment that are normally harmless. Some of these conditions that can occur by that are asthma or eczema. The autoimmune system is when the body attacks normal, healthy tissues. The cause is unknown. The 3 common immune diseases are the type 1 diabetes, the rheumatoid arthritis, and the lupus. Discuss ways of reducing risk of allergy. So we go on to food allergies. So for preventing food allergies, it would be to kind of wean the baby onto different types of food within 3 to 5 days to know what the child is actually allergic to. Also, breastfeeding is a good way of nourishing the child as it strengthens the infant's immune system and can cause them to fight away allergy faster or better. Dust mites. So dust mites are airborne that may trigger allergy or asthma symptoms. Reducing contact with these substances early in the life may delay or prevent allergy or asthma symptoms. If the child is at high risk of dust mites and allergies, there are zippered allergen impermeable covers on pillows and mattresses, and wash bedding in hot water weekly would be required to do. Also, the indoor humidity should be kept at below 50%. So some may be allergic to pets and other animals, which can cause allergies and asthma also. So to overcome this, it would be best to talk to the doctor to know what is best for the family. Lastly, we've got tobacco, which is important not to expose in front of children. Also, while smoking whilst pregnant can cause the child to be wheezy during infancy, and exposing children to second-hand smoking can increase the development of asthma and other chronic respiratory illnesses. Right, so to conclude this presentation off, it has stated the importance of the immunity and the ways that it works, the cells which are used for the immunity to be able to fight away infections, and how they recognise certain infections. It has also stated how vaccines work, but depending on the person, they can work differently on everyone and how they should be handled. To end the presentation off, I have shown the understanding of allergies and how important they are. Are there any questions that would like to be asked?